Hey guys, it's Louis here from ndxtesting.com, and in today's video, we're going to speak about how to stop mouth breathing. Now, before you try to stop, right, you need to be able to understand the implications and the consequences of mouth breathing that can have on your health. Once you understand that, then you can make the necessary adjustments to be able to switch, because you could be used to mouth breathing for a very long time, and you're going to find it very, very hard to breathe through your nose. Well, I know once I understood, I was able to switch automatically, but that might not be the case with you. But the first thing you need to understand is this. Look, when we breathe through our nose, right, it's the first line of defense when it comes to our system, when it comes to our bodies. It filters the air, it purifies the air that we breathe against pathogens and allergens, and then that air that we breathe in, right, goes right into our lungs, and then from the lungs into the rest of the bloodstream and vital organs. But when we breathe through our nose, it creates a scientific molecule called nitric oxide. And we need nitric oxide in our blood vessels. What does that do to our blood vessels? It widens your blood vessels. And when you have wide blood vessels, what do you think is going to happen? Blood is going to flow thoroughly with no problem. Your cardiovascular system will work amazingly smooth. Okay, and you won't develop blood pressure, high blood pressure, if you have wide blood vessel. Now, what happens when you breathe through your mouth? It decreases your nitric oxide intake by 200%. And over time, it's going to narrow your blood vessels, and blood won't be able to flow thoroughly. You're going to end up, then you can develop high blood pressure. You can develop a rapid heart rate, anxiety, and many other diseases. We're going to go into some of these diseases in a second, but I need you guys to be able to understand. Once you understand the implications of it, then you can start making the necessary adjustments like I mentioned earlier. But let's look at some of the diseases that are linked to not low oxygen levels when it comes to our body. Look what Dr. Heidrich Hendricks, DDS, said about low nitric oxide levels. Here's a few diseases associated with that. Right? High blood pressure, heart disease, heart attack, stroke, digestive tract issues, such as irritable bowel syndrome, Alzheimer's disease, dementia, erectile dysfunction, and bladder issues. We also have anxiety, insomnia, sleep apnea, and other cardiovascular diseases that stems from mouth breathing. There's fatigue, headaches, there's so many other things. So over the years, and I'm not saying that you're going to mouth breathe tonight, in a couple of weeks, let's just say you're a nose breather and then you breathe through your mouth. That's not what I'm saying. Chronic mouth breathing. Over the years, if you are unaware that you're not supposed to breathe through your mouth, then you will get sick. Listen, I was unaware. And I was unaware for more than 25, all my life, 30 years. I don't even know how long, but I was breathing through my mouth. And the situation is that 80% of the population in this world, all over the world, suffers from the same problem. No wonder there's so much disease. If you learn about the consequences, the implications of mouth breathing can have on your health, and you switch to nose breathing, then you're going to improve when it comes to some of the symptoms that you might have now. You might have high blood pressure, a rapid heart rate, anxiety, insomnia, the beginning of stages of sleep apnea, fatigue, headaches in the morning, or perhaps you might even wake up in the middle of the night gasping for air. Those are the beginning stages of sleep apnea, and all that because you're mouth breathing. But not only that, mouth breathing can really affect the shape of your face. It can create an overbite, and if you have an overbite, that's going to complicate the way you close your mouth at night, and that could be challenging in order for you to breathe accordingly through your nose. The bottom line is that sleeping and breathing is the most important thing for our health. And you need to be able to breathe through your nose accordingly, and you need to be able to sleep accordingly. If you can't do that, then you have to do whatever it takes to be able to change your life. And with the help of physicians and wearable technology, whatever it takes for you to be able to understand this situation and breathe accordingly. So with that being said, let's go and discuss how can you stop mouth breathing. Okay, so the first thing that we need to understand, right, is proper tongue posture. Now that we know that we can't be mouth breathing, obviously during the day, we're not going to be like, We can't do that, okay? So once we learn about proper tongue posture, right? So let's just say that this is the roof of your mouth, the top palate of your mouth, and this is your tongue. Your tongue always belongs in the top palate, like that, mouth closed, okay? And during the day, breathing should be smooth. So smooth that no one can tell that you're breathing. You see, this is breathing. Smooth. Have you ever seen have you gone to the animal kingdom and you see animals breathe? Pay attention to the way animals breathe. They're not breathing. Usually when that happens is because, you know, something's wrong. Maybe I've seen maybe a dog do that, but he's out of breath. Maybe he's thirsty or whatever the situation might be, but they don't breathe that way. Animals don't breathe with their mouth open. They breathe through their nose. Like I mentioned before, the mouth is for eating and speaking. The nose is for smelling and breathing. We can't get that confused. A lot of people, perhaps unaware, they fail to understand that the nose is for breathing only. So during the day, if we have good tongue posture and we start training our minds, putting this information into our subconscious, where the tongue's supposed to be, our lips seal closed and breathing through your nose, later on that will translate during the night. So tongue posture and breathing accordingly through your nose is key. Now, when we sleep at night, right, it's important that we have a good sleeping position. Because that's what happens sometimes with mouth breathers. What do? They sleep on their back with a flat pillow, and that's going to stem you to mouth breathe a little bit more. And if you be mouth breathing for 5 years, 10 years, mark my words, you probably have an overbite. Well, later on, we'll speak about going to the dentist and going to an orthodontist. They can maybe help you with that overbite. And if you bite, which is the foundation of your face, if you have an overbite, it's going to change your appearance. If you have a perfect bite, it's going to enhance your appearance. And if you have a good bite, then you're going to be able to breathe better. So one of the things that we have to do at night, okay, is that we have to sleep in a good position. A good position is maybe using about 3 pillows, right, and sleeping on the side. Have the information in our minds that we need to breathe through our nose and then keep our mouth closed. I sleep elevated. And I sleep on the side. It could be the right side or the left side, and keep your mouth closed. And you don't want to have your face looking at the ceiling, because then that's gonna stem you to open your mouth. But you want to look down and sleep without a problem. Start putting that information. Second is you should go to an ENT doctor. That's an ear, throat, and nose doctor. And what that doctor is going to do, right? He's going to check you. He's going to check your nose, your throat. He's going to check everything. You want to make sure that you don't have any breathing obstruction, because you can have some obstructions and they could be removed. Maybe some antibiotics or whatever the situation might be. But you can have breathing obstructions in your nose, and you can have breathing obstructions in your throat. You need to make sure that nothing is going on, because if it is, then that could be the problem. Okay. Most of the time, I think probably about 40% of the time, it's people that develop bad habits. What was my problem? It was a bad habit. From very early age, I started breathing through my mouth. And when you breathe through your mouth, then it clogs up your nose, and then slowly but surely you develop an overbite. When you breathe through your mouth, what that does, and you develop crooked teeth, you develop gingivitis, you develop a lot of jaw problems, and your jaw, it doesn't develop accordingly, and it affects the shape of your face, and then that can affect your breathing. So you have to find out why you are mouth breathing. If you're mouth breathing because it's a bad habit, then you need to switch automatically. So since I have an overbite, and my overbite cannot be corrected by maybe braces or Invisalign, that's another story. I train myself during the night. I don't like to play around. Remember, I said that when you breathe through your mouth, you're going to lower your nitric oxide levels. And if you do that, it's going to narrow your blood vessels. You're not getting enough oxygen when it comes into your cardiovascular system. Now think about this for a second. Let's just say that the oxygen that you have in your room right now while you are listening to me. It's cut off by 50%. What do you think is going to happen to you? You won't be able to breathe accordingly. And eventually, if that oxygen is not turned on to 100%, then there can be some lethal consequences. So the same thing happens with our bodies. If our oxygen levels are lower because we're not breathing accordingly, or we're not aware of the way we're supposed to breathe, we're going to have some serious consequences. That's why it's key that you change. And maybe you can be having high blood pressure and anxiety, insomnia, all kinds of issues, a rapid heart rate, the beginning of stages of sleep apnea, and you take in medication. And one thing you need to realize that when you take medication and you don't know the root cause, you need to understand that you got the medication, you have the medication fighting against these symptoms that are being created, but you have the root cause causing the symptoms. It's my guess, as much as it's the doctor's guess or it's your guess, you do not know who's going to win. So you need to be able to tackle the root cause of whatever problem you have. You need to find out, regardless of what's going on. You need to know what the root cause is, and then you could take some medication and then it will definitely work. Anyway, so going back, so what I do, right? Pending that you could, so I don't have a problem breathing through my nose. I have an overbite, okay? So now there's a company called Somnifix, somnifix.com. It's a company that specializes in mouth tape. Mouth tape is very, very important. So what I do is I put a little mouth tape in my mouth. Okay, this is medical tape. I've been using it for years, okay? And I breathe through my nose. Now you can still open your mouth and you can still breathe, but this helps you train your mouth to stay closed. And then it's going to maybe come off at times until you get better. But mouth tape is popular and you can use it. But before you do, you have to know if you can breathe through your nose. Because if you can't breathe through your nose, if you have some sort of deviated septum, severe, and you have some nose issues, you won't be able to use mouth tape. So you need to clear yourself from that. You need to know, and the only way to know that is by going to a doctor, just to make sure that you don't have any breathing obstructions going into your nose, and then also your mouth. You need to find out exactly what's going on. Another thing that I do, okay, sometimes I use some nose clips. Okay, I put them in my nose, and sometimes I use both the tape. Now I don't do that every single night, but most of the times I do. In summary, okay, the precision. Most people that are mouth breathers, right, have the tendency of sleeping on their back, because that was my problem. Okay, so the precision of your sleep is crucial in this situation. In order for you to stop mouth breathing, you got to sleep on the side, elevate it with 2 pillows, put it in your mind, close your mouth, breathe through your nose. And obviously you have to, you want to go to the doctor to find out if you have any breathing obstruction. It could be a simple situation where if you just change, all the problems will go away. Maybe you've been breathing through your mouth for the last couple of years. Maybe it hasn't been 10 years, 15 years. And once you have this information on your subconscious, just change. Just during the day, practice good tongue posture, breathe through your nose during the day. And then that would translate slowly but surely during the night. And then if you could, then probably a little mouth tape and some nose clips would definitely help you. But the precision where you sleep is key. Now, if you have a chronic to severe overbite, then you should see a dentist, and the dentist will send you to an orthodontist. And in orthodontist, if you have an overbite, that overbite could be corrected. Once you have a good bite, then you'll be able to sleep in a good position. You'll be able to close your mouth. But maybe that could be the problem with you. You probably maybe have a chronic to severe overbite, and that's because you've been mouth breathing all your life, and then that could be corrected. So solution number 3 is that it's important that we find out exactly what's going on in our sleep. So if we are breathing through our mouth all night long, there's going to be some serious consequences. Now, there's been an explosion when it comes to wearable technology. You can have a smartwatch like I have now, And this is not an Apple Watch. This looks just like an Apple Watch, and it works maybe even better than an Apple Watch. But it tells me all the information that I need to know, from my blood oxygen levels to my heart rate, the steps, the calories. But it gives me key sleep information. It lets me know if my breathing is intact. It lets me know if my oxygen levels are dropping. And remember, I was telling you that if you breathe through your mouth, your oxygen levels are going to drop significantly. So it's important that you know if your oxygen levels are level the way it should be. It should be within, definitely into the 90s. So getting a smartwatch, it's key. I'll post a link to this one that I have on, and this is a fraction of the price of what many of these smartwatches go for. Okay, another thing that we can use, right, to find out what's going on with our sleep is I have this small ring device here. This ring device, you put it on, it automatically tells you your oxygen levels and your heart rate. And what happens too, that if you breathe through your mouth, right, you're putting unnecessary stress on your cardiovascular system, and your heart is going to work faster. It's going to work not faster, it's going to work harder. And then if it works harder, then it's going to beat faster. Your heart at night when you're sleeping should be nice and calm. This will let you know exactly what's going on. Your oxygen levels, your blood oxygen levels, your heart rate. It lets you know if you're snoring. It lets you know a lot of different, it gives you key information, so that way you can make good adjustments. And you want to find out what's going on, because if you know exactly what's going on in your sleep, then you can make modifications and you can improve your health. And you have to know. Another thing is that I always tell people, listen, sleeping and breathing is the most important thing that we could do for our health. But we can't sleep and if we can't breathe accordingly, we're going to develop some serious health issues. We are in the year of 2023. Like I said before, wearables are exploding. They're coming from different directions. I took a sleep study a long time ago by a professional company called Home Sleep. Now, this is not Home Sleep, but this is just like Home Sleep. This is a device that you connect yourself to. You can connect yourself in 5 minutes. And when you wake up, you can find out very advanced information about your sleeping, about your oxygen levels, about your snoring, about your health. And then you can take that information and you can give it to one of your doctors. A sleep study that you can have at home. So it's not that difficult. With the right information, with the right channel that can give you access to this information, you could improve your health. I've been able to improve mine. At one time, I got really sick in 2017. And if it wasn't that I was diligently believing that there had to be a root cause, if I were to follow the advice of some of the doctors, just this genetic disposition, there's nothing that they could do. It's impossible that this is coming from your sleep. Imagine that. I'm spoon feeding these doctors and they couldn't figure it out. All they had to do was, like, if I'm telling them, listen, I go to sleep fine, I wake up, this is the way I wake up. Oh, you go to sleep, a sleep medicine doctor. But it just was not clicking. And this channel is here to help you. I have a lot of experience now. I'm not a physician, but I am a technologist. I'm registered in the field of electrodiagnostic medicine. I specialize in the peripheral nervous system, which is nerves and muscles. So I do nerve examination. I see patients all day. And I know how to take care of my peripheral nervous system, which is my nerves and muscles. Likewise, if you know how to do that, then you know how to take care of your cardiovascular system, which is your arteries and veins. Those are the two major superhighways of the body. You need to take care of them. You have a body. You need to learn about your body, and you need to take care of that body. But anyway, guys, I hope this video has been helpful. If you haven't subscribed to our channel, please do. If you like this information, please like it. If you have any comments, if you have any questions, well, ask us as many questions as you want. We're still relatively a small channel, so we do have time to answer these questions. With that being said, I'll see you in the next video. Bye-bye.